Well, welcome. Thank you for joining us here at Rolling Hills Library in St. Joseph, Missouri. We're very pleased to have today with us Dr. Reed Wall of Freudenthal Home-Based Healthcare. Dr. Wall is a certified therapeutic pain specialist and also the director of Freudenthal's physical therapy services.
I'm going to go through this presentation here and then we'll answer questions at the end. However, I do want everybody to think of this as an interactive presentation. So as we're going, I'm going to be basically asking some questions, and I want you to answer the questions to yourself. So you get out a pen and paper and you're just going to write true or false as you go through, and you're going to score yourself at the end of how well you did. So this is going to be a conversation about pain. And the focus of this conversation is going to be primarily about misconceptions about pain. What have we learned over the course of 50 plus years of researching pain and how it works in the body, and still how much we don't even know. There's so much we don't even know, but we've learned a lot. And some of the things that we've learned have caused us to step back and take a new look at how pain works in the body, and then let that new understanding change the way that we treat it. Here's a couple objectives. Understand the difference between three categories of pain. Learn that pain and injury don't correlate very well. Understand that a quality of life can still be attained despite the presence of pain, and then learn some common misconceptions about pain. So we're going to spend a little bit of time on this slide. And for just simple thinking, I like to keep things in simple constructs because it's much easier to understand if we keep it simple. A lot of people out there are a lot smarter than me, and they delve into the complexities of things, and that's where they like to live, but I like to live in the simple world. So we're going to talk about three different categories of pain from a diagnostic perspective. This is important because diagnoses, their value is that they direct treatment. So without a good diagnosis, we can't really know what direction we need to go with the treatment, how we can help this person, what's causing the problem. Okay, so the powers that be out there have broken down pain into basically three categories from a diagnostic perspective. And the first category is what we call nociceptive pain. Now that's just a big fancy word that says that it's a non-nerve injury in the body. So that means that the processes that are in place that are driving that person's pain are primarily periphery. So that means out in the body. Okay, neuropathic pain, which means it's a nerve injury or insult or irritation, is the second category, and that's also a peripheral thing. So for the most part. And so what we're looking at there is that the tissue that has been injured or irritated or, insulted is nerve tissue. And nerve tissue and non-nerve tissue are different enough in the way that they present and the way that you have to treat them that it gets its own diagnostic category. And then we get to nociplastic pain, and that's just a combination of the word nociceptive and neuroplastic together. And what that means is that there have been changes in the way our nervous system is processing the information that it's getting, and that those changes are causing processing errors that are then perpetuating that pain state. In most cases of nociplastic pain, people have had some originating injury, and then just the pain didn't go away like it normally would. So if you think of the nociceptive pain, that non-nerve injury, as your typical ankle sprain. Yep, you rolled your ankle, twisted your ankle, now it hurts, it's red, it's hot, it's swollen. Right? So that's the kind of pain or injury that you would think of typically for like a nociceptive pain, non-nerve injury. It's also important to understand that you can have overlaps between these categories. You can have multiple injuries happening at the same time, all due to the same event or due to separate events that can be all kind of in place. In fact, I treated a patient once that had all three of these going on at the same time. And the things that we did for the number 1 category of pain was different than the things that we did for her number 2 category pain that were different from the things that we did with her number 3 category pain. And all 3 of them got better. But if we had tried a one-size-fit-all approach for all 3 of her painful areas, we would not have been successful. And so we have to come to a good diagnosis right off the bat, or else the direction that we go in treatment is not going to be helpful. So kind of just a broad understanding that there are different kinds of pain, and the different kinds of pain have to be treated differently. And in order to know that, you have to do a good thorough examination, you have to have a good history, you have to have a good you have to understand the story behind each patient and their experience. And so that's kind of a detective process that the medical practitioners have to go through in order to learn. So 3 categories of pain. And basically what this means is that we have 3 buckets for pain. And so this is a little different. This is not a diagnostic category. This is just kind of an understanding of what that means. We can have pain-free injuries. Let's think about that for just a moment. A pain-free injury. That means you hurt yourself, but you didn't know it, or it didn't hurt. There was no pain associated with that. Most people, if they think about it, they can think back to a time where they did something. They fell, they bumped their knee, they hit their shoulder or their elbow on something, they got a paper cut or a bruise, or they started bleeding, and there was actually no pain associated with that. Like, it didn't hurt, you just noticed that you'd injured yourself. And then maybe somebody asks you, hey, why are you bleeding? And you look down and you realize, oh wow, I am bleeding. I didn't even know that had happened. That's an example of a pain-free injury. Another category is you can have a painful injury. And this is normally what we think of. We hurt ourselves, we've injured ourselves, we expect pain with injury. And in a lot of cases, that's exactly what happens. And then you have injury-free pain. This is the really confusing one. This is the hard one to diagnose. It's the hard one to treat, because what we're saying here is that either there is no injury that we can identify, or the injury that started the pain has healed, but the pain hasn't gone away. So kind of keep this in the back of your mind, that there are pain-free injuries, and that bucket we don't think about very often, because most of the time we don't even treat them. Like, we know oftentimes we may not even be aware that they're happening. We have painful injuries, and then we have injury-free pain. So let's start with just a brief definition of pain. And this is not the full definition, but this is captures the essence of the definition of pain. According to the powers that be who set definitions for words, this is an unpleasant sensory and emotional experience that's associated with actual or potential tissue damage, or oftentimes thought of in terms of that damage. So let's break that definition down just a little bit. Obviously, pain is unpleasant. That was an obvious one. But notice in here that it says it is both a sensory and an emotional experience. It's more than just a sensation. When we have pain, we have it not only physically, but also emotionally. And it's a two-way street. So when a person has emotional pain, they oftentimes experience it with physical symptoms. This tightness in your chest, or a sinking, churning feeling in your stomach, or something along those lines. Everybody kind of has their own personal thing, but when they've experienced heartache, they experienced a physical symptom with that emotional experience. And when they have physical pain, you're walking through their house at night, and it's dark, and you stubbed your toe on that coffee table and it hurt. But you also probably had an emotional experience where you were frustrated that that stupid coffee table was in the way. And I knew that it was there. How come I kicked it, there's a frustration that goes with that sensory experience. So when we look at our body's threat detection system, okay, this is a subset of the nervous system that is responsible for feeding information up to our brain that tells us of potential dangers. Okay, our body's threat detection system. Imagine if you're walking out, you're barefoot, you go outside to get a package off your front porch and you step on something and you feel a sharp stabbing pain on the bottom of your foot because you walked out there barefoot. You look down and you realize you'd stepped on a nail. Everybody would probably want to know about that, right? And so, but the question arises, how did you know you stepped on it? I mean, you don't have eyes on the bottom of your feet, so something had to clue your brain in that you had stepped on something sharp. And so we think about those nerves that identified that, sent that information back up to the brain, and then the brain realizes, hey, dummy, you stepped on a nail. You probably shouldn't have been walking outside barefoot. And so then you take action. You pull the nail out, you clean it up, maybe you go to the doctor and get a tetanus shot, who knows? But the pain doesn't go away right away. It takes a little while for it to kind of calm down. What happened there is, as your nervous system sent that information to your brain for processing, the brain and spinal cord both participated in the processing of that information, and then they produced an output. They created a plan. A lot of this is happening subconsciously. We're not consciously aware that it's even happening. And so then that plan is to get our attention so we can deal with it. We can treat it. We can, pull the nail out. We can get a tetanus shot. We can clean it up. We can make sure we remember to wear shoes next time, or look at the ground before we step down to make sure there are no nails, those kinds of things. And so with every processing of information, there's a decision to act, to do one thing or another. And that threat detection system that tells us about these things is hardwired into our emotional centers of our brain, the parts of our brain that process our emotion. And so it is impossible for us to have a painful experience without also having an emotional experience. And that's very important, because if we don't understand that there's an emotional component to pain and our healing and recovery, then when we come up with a recovery pattern, a recovery strategy, or a treatment plan, then it's going to be incomplete. And if it's incomplete, then we may not resolve the pain correctly. And so that's important to understand. There's both a sensory and an emotional component to the experience of pain. Pain is more, it's multidimensional. It's more than just a sensation like pressure or hot or cold. Okay, true or false question. This is where you guys at home are going to be writing down your answers and thinking to yourself. So let's think through this. True or false question. It is possible to have pain and not know about it. I'll give everybody a second to think about it, and then we'll talk about the answer. Now be careful. This is not stating it is possible to have an injury and not know about it. This is asking, is it possible to have pain and not know about it? Because as we talked about before, pain and injury are not the same thing, and they don't correlate very well, which means that you can have pain without injury, and you can also have injury without pain. So don't think of this in terms of injury, but think of it in terms of pain itself. Never known anybody ever who had pain and didn't realize they were hurting. Pain is a conscious level experience. Again, you can have pressure sensation and not realize it. Like somebody can be touching you, you can even subconsciously be responding to pressure and not consciously know about it. But when you have pain, pain is a conscious level experience. It's not possible for you to have pain and not know about it. So next question, true or false? When part of your body is injured, special pain nerves convey pain messages to your brain. Now think about this, okay? We're going to think about this question for a moment. And this is kind of a tricky question because we tend to think about our body's threat detection system as the pain system, pain nerves, messages about pain to the brain. But remember, the threat detection system only reports information to the brain. It doesn't do anything with that information. It just simply reports it. It's just the messenger carrying the message. That message has to be interpreted. Remember, there's processing of the information, and then there's a response to that information, to the conclusion that the brain has come to. Is this dangerous or is this not dangerous? So if we think about information coming up from the body, you stepped on the rusty nail. The information that's coming up is sharp sensation, chemical and detection of inflammation that's happened because the barrier of the skin was broken, and so cells were disrupted, so that triggered an inflammatory response. So there's chemicals in play there. Specialized nerves are picking up on those chemicals' presence and reporting that information to the brain. And then specialized nerves called nociceptors, which is our body's threat detection system, picks up the possibility of danger. This represents a danger to the body, our potential danger, and it's sending that information into the brain. So messenger comes in from the battlefield to the general, and he hands him a message, and the message says, you stepped on something sharp, inflammation is beginning, this might be dangerous. The general then looks at it, looks at the big picture of what's going on in the body and says, yep, that's dangerous, better sound the alarm, we got to respond to that. We're going to respond by turning pain on in the foot. So the conscious mind is now aware that, hey, I stepped on something sharp and it hurts and I got to deal with that. Pain is a motivator. It motivates us to do things. It motivates us to not do things. It is very difficult to ignore. It's designed that way. And it clues us into possible dangers. So when we think about this question, the key here is this a specialized pain nerve? And the answer is false. Pain isn't generated at the point that the nerve is picking up the information. It's generated after the information has been processed. So pain is actually a response to the information, not the information itself. So that is false. Forms that they fill out where they're answering questions about their function and their state and their emotions and all kinds of things. And you know what they discovered is that there's a lot of people out there who have the same injuries as people who are in pain, but they're not painful. Disc injuries that have no pain associated with them at all. 2 out of 3 people with rotator cuff injuries don't have pain. There are people, lots and lots of people out there with arthritis in joints that aren't experiencing pain with it at all. And so what that tells us is that it's possible for a person to have an injury and not have pain. So there's got to be something different, more than just the presence of an injury, in order for a person to experience pain. It's got to be a little bit more complex than that. So the leading theory then is it's how the brain is perceiving the injury that determines whether or not the person's going to have pain with that injury or not. And so if we think that through, then on the flip side of it is that in some, not very often, not common per se, but it's definitely the minority, there are actually documented cases where people have had pain purely as a result of an emotional experience. Physical pain as a result of an emotional experience. No injury, no illness. It was purely an ideation or a thought process that happens. And that thought process and that emotional experience that came with that trauma triggered physical pain in that person. So obviously in those rare circumstances, if we're trying to treat the physical site of where they feel the pain, we're not going to make any progress. We have to treat the root cause, and that is their emotional trauma. Now, granted, this is not the majority of cases. The majority of cases, people start with an actual injury, and then for some reason, that injury either it heals, but the pain experience persists, meaning that the nerves remained sensitive even after the injury itself had recovered. Oop. You got a freebie there. So, when you're injured, special nerves convey danger message to your spinal cord. This is true. Yes, everything we've talked about right so far. We have specialized nerves that are designed to pick up danger. And that danger can be represented by a single intense experience or a series, like a high volume of small experiences that all cumulatively add up to a conclusion that, hey, this might represent danger to the body. And then that information is processed through the nervous system up to the spinal cord. And then that's the first step of processing happens in the spinal cord, where the spinal cord is actually determining, does this information get sent up to the brain, or am I going to kill the signal right here? So that's true. Information is carried on nerves to the spinal cord and then to the brain, where the information is interpreted as either threatening or non-threatening. So hopefully you guys are seeing that one of the key themes when it comes to understanding pain is understanding what is making the body feel threatened. If we can identify that, we've identified the source of the pain and what's triggering it, what's driving it, and then we know what to do to start treating it. So, question: special nerves in your spinal cord convey danger messages to your brain. Yes, this is true. Body has special nerves. We've talked about that. The threat detection system. The medical word is nociceptors. They are not pain neurons. They are danger neurons. The body has special nerves that are dedicated to sensing potential danger. When these fire, they send information to the brain that may result in pain. And I'm just going to be honest, the majority of the time they do result in pain. I mean, that's kind of our body's hardwired threat detection system. It's when it fires and sends messages, the majority of the time we're going to respond with pain. But it's important to understand that just because those nerves are firing doesn't mean we have to have pain. Here's where hope enters the equation. Think about it with me for a moment. Bones heal over the course of 6 to 8 weeks on average, depending on the severity of the break. Most people who experience a broken bone are not in pain for 6 to 8 weeks. What happened? Their pain was intense early on, but then gradually diminishes over time until eventually they're relatively pain-free, even though the bone has not completely healed. The majority of cases, this is the way it is. And what's happening is that the nervous system is becoming desensitized over the course of time through exposure to all the things that it thinks might be dangerous to it, right? Movement, pressure, weight bearing, those kinds of things. It's not uncommon for a person to be relatively pain-free after a fracture of a bone within 2 to 3 weeks, even though they still have 5 to 6 weeks of healing that's still going on in the bone itself. So we have to kind of separate in our mind this idea that just because I hurt, there must be something terribly wrong, right? We have to learn to to recognize that, yes, I need to take action. I need to protect that part of the body, but I also need to start exposing it to real life again, to movement, to exercise, to things, but in a controlled, cautious, protected way of doing it. So nerves adapt by increasing their resting level of excitement. So nerves are electrical conduits. That's how they send information, through chemical and electrical processes. So chemistry happens between nerves, which triggers an electrical current. that travels up the length of the nerve and then results in more chemistry as it transitions between one nerve and another nerve. This is how nerves talk to each other, through chemistry, and then they send that message back and forth along their body through electricity. So how much does it take to trigger a nerve to send that signal or not send that signal? When a nerve sends a signal, it's all or none. No halfway sending of signals. It's either going to send that action potential, that electrical current, or it's not going to send it at all. And so if every single nerve sent a message every single time something happened around it, our brain would probably just be like completely overwhelmed with all the information. As it is, our brain is, and our spinal cord and our midbrain, like our brain stem, is constantly in the process of filtering out large portions of information that's coming up from the body. Every time a nerve signal comes to the spinal cord, there's specialized nerves there that are determining whether or not that information is getting passed up or whether or not it's nixing it right there at the door. And the vast majority of the information that's coming up is actually getting nixed at the door. Like, some people estimate up to 70 to 75% of the information coming in from our body is actually being stopped at the level of the spinal cord. And then once it comes up to the brain stem, as it just enters the brain from the spinal cord, that happens again. So the volume of information that's coming into the brain has to be dampened, or else we wouldn't be able to process it all. It's far too much information. So one of the ways that our peripheral nervous system participate in that dampening of information coming in is that they don't respond to every single thing that happens around them. It takes a certain threshold, a certain amount of base level pressure to get that pressure nerve to send a signal saying, I've been activated. It takes a certain amount of sharpness or pressure to get that sharp touch nerve to send a signal that says, I've been activated. And the same thing with our threat system. Our threat detection system, those nerves have a really high threshold of activation, and that's good because we don't want a false alarm. We don't want our house alarm system going off every time a leaf blows by the front door. So we want it to be high. We want it to not respond to things unless it really poses a danger. However, nerves are highly changeable. They have this wonderful ability to react and adjust and learn. And as a result of that, they have this ability to adapt by increasing or decreasing their resting level of excitement. And excitement just simply means how much activity is going on electrically in that nerve. If there's not a lot of activity, then it takes a lot more to trigger that nerve to send an electrical signal. If there's a lot of excitement, it takes very little. Good analogy for this is a trigger on a pistol. You go out to the range and you're shooting your pistol, and if it's got a hair trigger, you might accidentally discharge that firearm before you were really lined up on your target because you accidentally touched the trigger, and you put too much pressure on it before you were ready. If it's got a really heavy trigger, then you may be pulling on that for a full second or two before it discharges the gun after you've lined it up on the target. And so nerves can change their level of sensitivity. And more sensitive nerves send more signals. More signals tend to result in more intense pain when we have pain, because it tends to correlate with higher levels of threat. So this is a true statement. Nerve can become more or less sensitive. A host of different things can cause that change, and many of them are driven by things that happen in our own brain or body and in the local tissue and in neighboring areas of the body or even outside of our bodies. So an example of this would be imagine you're walking down a path and it's a beautiful sunshiny day, 60 degrees, you got a light jacket on, you got your tunes playing through your earbuds or headphones, and you turn the corner on the trail and you see a ginormous grizzly bear. Life suddenly changed for you. Everything went from calm and pleasant and wonderful to suddenly your body is going through some very rapid changes on the cellular level. Your body is being flooded with chemicals that are designed to prepare you to survive this chance encounter with a grizzly bear. Your heart rate increases, your blood pressure increases. Certain nerves activity are sensitized because your brain wants to know as much as it can about certain things. However, certain bodily functions are decreased. Your, ability to hold your bladder and bowel, no longer important. So oftentimes people have difficulty holding their bowel and bladder in that kind of stressful environment. Peripheral vision goes away. Everything is tunnel vision right here. Fine motor control, not important. Why? Because survival in that circumstance is more centered around gross motor movements, large movements, not fine movements. You don't need to thread a needle when you're trying to survive an encounter with a grizzly bear. Reproductive systems, no longer high priority for blood flow or neurological activity. And so the immune system, not a big deal. It's decreased. And so all of that stress hormone, the cortisol, the adrenaline, that causes the body to sensitize nerves. So this is kind of like a fun, extreme example, but we go through stressful events all the time. And stress is kind of like a gasoline on a campfire, right? We've got a nice, pleasant campfire. It's not that big a deal. It doesn't represent a very big risk. Then somebody comes along and throws, a can of gasoline on it, and all of a sudden it flares up really big. And so when we have an injury, and then you add stress to that injury, fear, anxiety, depression, those kinds of emotional experiences, it can sensitize the nerves even further, causing more danger signals being sent up to the brain and the spinal cord. Thus, the nervous system as a whole is now preparing for a much, much more dangerous experience, when in reality, it's not all that dangerous. It just seems like it is to the nervous system. Okay, so the chemistry in our body can affect the sensitivity of the nerves, making them more or less sensitive. We actually have chemicals in our body that are pain relieving in nature. In fact, our brain is capable of producing pain medication that is 50 times stronger than anything we've created in a lab. The strongest pain medicine sits between our ears. And so a lot of what we do in physical therapy is designed to trigger the brain to actually start releasing its own pain mechanisms, its own pain relieving medicine to relieve that symptom of pain, and that causes a desensitization of nerves. So this question here is talking about nerve sensitivity, and so yes, absolutely, nerves can become sensitive, or more sensitive or less sensitive, in a fraction of a second, which explains why sometimes people's pain comes on suddenly, lasts for a few seconds, and then goes away. This is a big one. Big one. Chronic pain means that an injury hasn't healed properly. True or false? Popular opinion would say true, but in reality, this is false. The persistence of a person's pain rarely means that the injury hasn't healed. Instead, it means that the nerves surrounding that area have not desensitized like they normally do. So take any 4 people who have an injury. 4 people get hurt. 3 of them, as their body heals, which our bodies heal on a very predictable scale and timeline for the most part. So as the body goes through these stages of healing and till they're fully healed, their sensitivity level of their nervous system and the correlated threat that associates with it starts to gradually decrease. Most of the time, our pain goes from 0 to 10 real quick, but it doesn't, almost never goes from 10 to 0 as fast as it gets from 0 to 10, right? And go figure. It's a lot harder to earn money than it is to spend it. But 3 of those people are going to have a normal progression of pain and sensitivity as they go through that healing process. Things are going to gradually desensitize until eventually they're pain-free. Life is back to normal and they're good to go. But 1 out of those 4 is going to have a pain level that prolongs, it persists long after their injury is healed. And we don't know exactly why that happens. That could be partially due to genetics. It could be due to things that were going on in their life at the time that they were injured or while they were recovering from it. We know from a lot of studies and research that people who tend to be in those complex, persistent pain states while they were going through their injury and the healing that happened after that, a lot of times those people were also experiencing a lot of stressful events in their life. Divorce, difficulties with children, they might have been concerned about their job or their life. They might have had a recent death of a loved one. Maybe there was an emotional trauma that happened with their injury itself that associated with that. Also, things that we believe about our body and our injury and how the long-term effect of that injury is going to happen. Like maybe that person believes that, oh, I had a disc injury, I'm never going to be able to lift or bend again, and that causes them anxiety. That fear that they may not be able to provide for their family or continue to work or to do their activity that they love to do might have played a part in that. We don't really know, but there seems to be a lot of correlation between these kinds of things and the presence of that complex persisting pain. Also, MRIs have been able to show that the driver for that pain goes through this process of shifting. So what's causing the sensitivity of that injury in the beginning is largely chemical in nature surrounding the injury. I sprained my ankle, there's inflammation. Inflammation is a chemical process that causes sensitivity of the nerves. It also drives and directs the healing process. So inflammation is not a bad thing, it's a good thing. But that sensitivity in that local area is mostly driven by inflammation in your category 1, that's the nociceptive, the non-neural injury, and your category 2, the nerve injury, neuropathic pain. But in nociplastic, that's your category 3, that's the processing error. What we actually see is as inflammation starts to dissipate, there are changes in the brain itself, that parts of the brain start to light up differently. We can actually see this on brain scans, and it shows that the activity in the parts of the brain that are processing the pain starts to increase. And what we surmise from that is that the driver shifts from a peripheral driver to a central driver. And what we mean by that is simply that it's no longer being driven primarily by inflammation in the local site, but is instead being driven by the processing of the pain in the brain and spinal cord itself. So changes are happening in the nervous system that are continuing that pain because it doesn't believe the threat is gone for whatever reason. And so that's the key idea here, the key takeaway here. While pain is a common response to injury, many people have injuries without pain, and some people have pain that persists long past their injuries healing due to mechanisms that we're only beginning to learn about. Musculoskeletal injuries nearly always heal. If they don't heal, it's due to some injury, disease process, or something like that that's preventing it from healing. And typically that's identifiable. That's identifiable. When we can't figure out why a person is having pain because there's no injury, there's no illness, then it starts to point us in the direction that maybe this is a functional processing of the information on a neurological level that's causing their pain sensitivity in their nervous system to persist. Yeah. Worse injuries always result in worse pain. See, now on surface level, this would seem to make sense. This sounds true, but it's not. How many people have had a paper cut? Worst pain ever. Probably on a scale of 0 to 10, as far as seriousness of injury, it's a 0. However, this is one of my favorite case studies. Woman walking home from work late at night in New York City, and she gets hit with a purse snatcher, tries to steal her purse, and she instinctively fights back. And so she doesn't win. The guy gets the purse. She sits down on a step, has a good cry, composes herself, and continues to walk home, where she walks in the door and immediately her parents freak out. She has no idea why. Well, come to term out, the purse snatcher, as he was fighting for the purse, buried a hunting knife to the hilt right between her shoulder blades. It has more to do with the brain trying to control the pain so it can survive, right? Less severe injuries tend to have more pain because this is the theory, isn't concerned about survival, and so it can really focus in on that pain and how terrible it is. And I'm not trying to make light of people's pain, but in comparison, severe injury versus less severe injury. Whereas the severe injuries that are oftentimes life-threatening, the brain recognizes, I need to do something to save my life, and I can't do that under a high level of pain, so I'm going to have to do something. So it starts to release pain-killing chemicals. It starts to desensitize the nerves in and around that area so it can focus on the thing that's most important, getting you out of that dangerous circumstance. And then later, the pain comes. Things like stress, anxiety, fear, depression, illness, among others. Okay, the list is too long for me to list, but these are the top ones. Among others, act as both triggers and amplifiers of threatening signals, thus the pain that we experience. All right, neurons traveling down from the brain are always off switches. This is false. The brain can inhibit signals, but it can also facilitate them. Sometimes the brain is actually sending signals down to that part of the body that is making the pain worse. I know. How dare it? Why would it do that? Why would it do that? Well, if we think of pain in terms of sensitivity of the nervous system, specifically as it responds to threat, so sensitivity and threat, those are our two themes when it comes to understanding pain and why people are hurting. If the brain thinks that there might be danger, it's going to want to know more about what's going on down there, so it knows what better actions to take. And the only way it can do that is to increase the sensitivity of the nervous system so that it's getting more information so it can make better decisions. So, what we want to do from a tricky area, we want to do that by setting, it helps it to understand and recalibrate the degree of threat that's associated with that thing that's causing it to then decrease its sensitivity, decrease its threat, and it starts to then turn off those threat signals. Pain occurs whenever you are injured. The obvious answer to this is true, but it is also false. We've talked about this. You can actually have injury without pain and pain without injury. Our bodies are robust, capable of healing themselves and functioning well even when injured. Despite the presence of injury, you can still function at a world-class level. Morgan Freeman is a great example of this. He struggles with fibromyalgia, chronic fatigue syndrome, and yet he is oftentimes producing 3 movies at once. The man is a world-class actor, works very, very hard, does not let his diagnosis control or determine the quality of his life. You have a torn or ruptured ACL. Congratulations, you can play in the NFL. Rotator cuff injuries or tears, even full rotator cuff injuries in some cases, depending on which muscle, congratulations, you might be able to play in the NBA. So our body's in a near constant state of repair, unlike our cars. So when I wear down the rubber on my tires, if I park my car in the garage, it doesn't grow new rubber. I've tried, it doesn't work. When something goes on, check engine light comes on my dashboard, if I ignore it, it doesn't go away. But our bodies are not like that. Our bodies are in a constant state of repair and maintenance, responding to the stresses that we place upon them. So a certain amount of stress is healthy, and it actually helps to stimulate growth and repair and healing. So when you injure yourself, the environment that you're in will not affect the pain or the amount of pain you experience as long as the injury is exactly the same. See, now, again, on the surface level, this seems true, but it's not. Think about whiplash injuries, car accidents. A lot of times people who've had a whiplash injury experience severe pain, and it lasts a long time. And that makes sense. But what about demolition derby drivers? Over the course of a night, they might have 5 to 10 to 12 whiplash injuries, and they walk out with no pain, no dysfunction. The difference, one is a victim of a set of circumstances that they did not want, that is associated with a lot of stress, and you're going to be damaged car, you're going to deal with insurance companies, potential police reports, loss of work, fear involved in all of those things. And the other one was a willing participant in a fun activity that he chose to be there. And that environment and the circumstances surrounding the injury actually plays a big part in how your body perceives the threat associated with that experience. So when the circumstances are welcomed, the threat associated with it is oftentimes significantly less. Think about boxers. Get punched in the face and, smile afterwards. I think about these boxers who won, at the end of the fight, they're being interviewed and they're all bloody and bruised and swollen and grinning from ear to ear, happy as a lark that they won. Their pain and the threat and the tissue damage that's associated with it is not nearly as big a deal to them as the person who got mugged on the street corner walking home that night. And, they probably have all the same injuries, maybe even less, but they experience a lot more trauma as a result of it. Okay. The brain decides when you experience pain. Hopefully by now you guys can all answer this correctly. True. The nervous system as a whole is all participating in it, but it's the brain that has the final say in the matter. It's the supreme controller. It is our ultimate guardian. It's one of its biggest jobs is to protect the body from threat, and it does that very efficiently and effectively. And pain is one of its best tools. So here's the question everybody wants to know. After they've learned and they understand these things, they always ask me, they want to know, so what can I do about it? Okay? Well, exercise more, but in small intervals that gradually increase in intensity and duration. I cannot emphasize this enough. Number one reason why people injure themselves in a gym is because they progress themselves too fast and attempted to do things that they were not ready for. Okay? Just imagine for a moment your car, the dashboard of your car, and that tachometer, that gauge that shows when it's how hard your engine's working at any given moment. It's got the little red zone at the upper end. Okay, I want to think of ourselves for a moment as our body. Here's our body's capacity. Capacity represents us doing nothing. Our body likes to function with the needle squarely in the middle. lots of reserve capacity. Everything we do on a regular basis is relatively easy, well within our capabilities. When we start to pin the needle, we can do that a little bit. But if we do it for very long or very often, our body will start to interpret that as a danger. And it will actually respond with a lot of things to try to prevent us from doing it. Dizziness, nausea, weakness, pain, you name it, anxiety associated with that thing, fear. And so it's trying to tell you this is not safe for you to do, stop doing it. But if we lift the needle just above middle and maintain it there for a long enough period of time, or do it consistently enough, our body will realize, I don't like to be here, I like to be here. And so it starts to increase our capacity, okay? If we push ourselves too hard, too fast, the body will react against that, and it's counterintuitive. It does not help us get to where we want to go. As a therapist, I am a big believer in consistent small changes that are regularly progressed. They need to be challenging, but they need to be doable. It needs to be something we can do successfully, and it needs to be the result of small changes over the long term. Oftentimes, people who struggle with complex, persistent pain states, they fall into this boom-bust cycle, and they almost learn to do it. Sometimes it's a personality thing, but I think a lot of times it's a learned behavior. I have good days and I have bad days, and so I better make hay while the sun shines. If I don't, I might not be able to get things done. But what they don't realize is that by working that hard on their good days, they overdo what their body's capable of feel safe doing, and then they spend the next 3 days to 3 weeks recovering from it. What that does is it reinforces that level of activity, or that specific activity, or that intensity of that activity, or that volume of that activity is dangerous, thus flaring up our pain. So then we have to spend 3 days to 3 weeks recovering from it. Whereas the better approach is to take it, enjoy that good day, maybe do a little bit more, but not so much that it flares you up. You break those tasks down into small pieces. You know, people with low back pain, they come in sometimes and they're like, I can't. So oftentimes people in the industry will ask them, if we could snap our fingers and make the pain go away, what's the first thing you do? And from a lot of housewives, we hear this question, I would vacuum my house. So many times they can't vacuum their house because it hurts too much. It hurts their hip, it hurts their knee, it hurts their low back, it hurts their shoulder. And so what we do is we break the task of vacuuming the house down into small chunks. It might take them 2 weeks to go through and do it, but they're able to do it. Maybe for the first time in 5 years, or 2 years, or 3 years, or 10 years, or 30 years. And that meaningful accomplishment has so much power to them. And so for other people, it could be raking their yard. They want to go out there and mow and rake and do everything all in one day because they feel good that day. But if we could, because I think we're all guilty of this to some degree, if we could realize, okay, this is a trap I'm about to fall into. I need to do a little bit and then rest, a little bit and then rest. And I might break this task down over the course of several days, but I still get it done and I do it without flaring myself up. Move more. Aerobic exercise increases the heart rate, increases the amount of blood in play. Our nervous system likes 3 things. It likes blood, space, and movement, so we can pump more blood around and oxygen around sensitive nerves. Studies show that it calms them down. So just 3 to 5 minutes of increased sustained heart rate activity has been shown to actually decrease pain levels in people. You get up and you move around, you're not so stiff. We live in a society that makes it really easy for us to sit long periods of time. And almost every single patient that I treat, one of the first things I do is I put them on an hourly progressive walking program. And what that means is I'm just having them stand up and do a short walk around every hour during the day. just to get them up and moving on a regular basis. The frequency is as important as the intensity. Just getting up and moving more. Starting small, building. Starting small and building. Sleep well. This is a whole nother presentation, folks. You thought this is just a 1-hour presentation, but wow. We could talk for hours on sleep. So important. Sleep deprivation negatively impacts every single physiological function of the body. 5 days in a row of 5 hours or less of sleep creates the same level of cognitive impairment that a 0.08 alcohol level would cause. So you effectively become cognitively drunk after 5 nights in a row of 5 hours of sleep. That doesn't help your nervous system recover. Eat good. Lots and lots of research out there showing that there is an association between our diet and how we feel. And most importantly, don't be afraid of your pain. It's there for your betterment. And we have to listen to it. If we don't respect our nervous system, it won't respect us back. But just because we hurt doesn't mean that we don't cover a level of function on the pain. Can't ignore it, but it can't be the central thing that we're focusing on. We have to maintain function. Thank you. And one of the things that I would recommend is if you are in one of those unlucky 4 people, one out of 4 people, the unlucky 25 is what we call them, who find yourself in a complex, persistent pain state. It is important to seek medical attention. You know, we never, as a clinician, I never want to be that doctor who assumes somebody is in that 3rd category of pain and not do a thorough exam to make sure that we're not missing something obvious. Maybe there is an injury that needs to be identified. Maybe pain that's not healing. Certain tissues of the body don't heal. Teeth, for example. My wife is a dental professional. It was a case that we ran across. Person had 10 years of jaw pain, and they x-rayed and couldn't find anything. And, you know, they did it. The person did everything they did to kind of have a quality life, to everything that they could to improve their life. But eventually he just went in there and said, I want you to pull this tooth. It hurts all the time. So they pulled the tooth, and in the process of pulling the tooth, they found out that one of the roots was broken. It had been fractured for 10 years, but it was so tightly fit together that it didn't show up on an x-ray. And so every single time they bit down or they did things, it would shift just a little bit and it would pull on those ligaments, and it was causing pain. And in that particular instance, you know, that's an injury that doesn't heal. A tooth will not heal by itself. If it breaks, it breaks. It's got to be dealt with as that in that case. So in that particular person, that person dealt with 10 years of pain. They didn't necessarily have to, because, and I'm not going to say that the dentist didn't do their job, because, you know, they x-rayed, they did everything that they could, but maybe if they had considered pulling the tooth 8 years prior, the person wouldn't have had to suffer for so long. So there is always the possibility that there is something that we're missing, or that we don't have the capability of finding. But we do, it's important to do a good medical workup to rule out all the things that need to be ruled out, because we definitely would prefer to find something that can be addressed than to deal with the processing type issue, or assume that that's the problem when it's not. Again, an effective and correct diagnosis is the most important first step towards treatment. You have to have that good diagnosis. So and after that, if they can't find it and they're pretty sure that they've got you in the right category of pain, then from that point on, there's a lot of things that can be done to help. And having the right coach along the journey, the right guide, can be the thing that makes or breaks the difference between a successful treatment and an unsuccessful one. So, but remember, there's hope. There's always hope.
Thank you so much. And remind us again, what's the best way to get more information about your services or Freudenthal in general? Maybe give us a little bit of contact information there.
Sure, absolutely. Freudenthal has a website, freudenthalhh.com. So FREUDENTALHH.com. I'll type that out there. And that would be a good place if you're feeling like home health physical therapy is the place for you. Now, of course, there are requirements for us to be able to treat a person in the home, but there's a number of different outpatient physical therapy clinics in town, in the St. Joseph town. And then, of course, there are resources online. The International Spine and Pain Institute is an online resource. That would be a good place for people to start if they're looking for resources and information about pain. A Google search for the neuroscience of pain is a good place. There's a number of different groups that have come up with a variety of different really effective ways to treat and people in that complex persistent pain state, that the unlucky 25%. And then remember that, pain medications are good. Most of them were designed for short-term use. They're not a long-term solution. So we're looking for something that is going to be more of a long-term solution. I like to tell people the story of my father. My father came to me about 6 years ago, said that he had pain in his foot, ankle, that was really starting to bother him, affecting his walking and all those things. And he said he talked to his doctor about it, and his physician's first step was fusion. Fuse the joint, surgery. So surgery is sometimes the best course of action for some people, but it's also the riskiest, most invasive, and most expensive. And so it doesn't make sense from a treatment paradigm to start there, the riskiest, most expensive, and most invasive. So I told him, I said, nope, that's not a good place to start. Have your physician give you some physical therapy. So he did a month of physical therapy. They gave him an exercise program that he continued on his own. He was very diligent about. And over the course of several years, he started to feel like it was getting better. And then eventually he was able to take his ankle brace off. And a couple of years more of continued persisting through this process, he was able to go off of pain medication completely. So now here's my dad, 71 years old, still working full-time plus at a factory, takes 0 medications. And the arthritis in his ankle that was about to bring him down doesn't hurt anymore. But it took him 6 years of working through a process that included changing the way that he thought about pain and how it affected his function and how he was going to treat it, feeling like he could be an active participant in his own healing process. And he went from a potential outcome of dysfunction to the current outcome of he enjoys good function in life, and he walks 6 to 8 miles a day on an ankle that they were going to fuse.
Wow.
So it's a great story. And then there are a lot of stories out there of people who've overcome this. So there's absolutely hope, and people who have been in very, very dark places in their life as a result of it. So they've come back from it. So there's always hope, always hope.
Well, thank you so much. Thank you for the information, for helping us think through how we even perceive of pain, and for giving us hope and some resources as well. Thank you so much for your time. We really appreciate that, and wish you well, stay well, take care. Thank you all for joining us. Bye-bye.
You're welcome. Goodbye.